A major UK survey has shown that patients with urological cancers are 5 times more likely to commit suicide than people without cancer. Well, here to tell me a little bit more about that is Dr. Mehran Afshar, who's from St George's Hospital in London. Hello to you.
Good morning.
So tell me about your research.
So in treating patients with urological cancers, we noticed that there were a high proportion of patients presenting with psychological symptoms and a lack in adequate services or an adequate infrastructure to address these issues in the health system. On analysing the literature, we found both a lack of adequate clinical research out there in this area, but also a real clinical unmet need. We know studies have shown that up to 2/3 of patients with cancer who present with significant clinical signs of mental health disorder go untreated. So we took to look at the rates of suicide in patients with all cancers, the top 10 cancers, over a decade in the national data set.
And you looked at an absolutely huge number of people, didn't you?
Yeah, just under 1 million patients we analysed, and we compared the incidence of suicide in those patients to the nationally published baseline population rates of suicide. And what we found was a profound, significant disparity, both for all cancers in comparison to the general population, and in particular urological cancers.
So what does that tell you, that urological cancer is particularly distressing or hard to cope with?
Yeah, well, I mean, first of all, we mustn't forget that all cancers have been shown here to have a higher incidence of suicide than the general population. So that's everybody. With regards to the urological cancers per se, there are issues that are very specific to this patient group. For example, patients with prostate cancer will undergo treatments that will affect their erectile function, libido, that will potentially cause urinary incontinence, bowel disturbance. It can affect their sense of self in a way that other treatments don't. For example, we can induce in some men symptoms similar to the female menopause that can be very distressing. And that can lead to relationship problems, it can lead to anxiety, depression, post-traumatic stress disorder, and in a minority of patients, unfortunately, suicide.
And you are recommending, obviously, that there's more psychological support, are you, for cancer patients?
Yes, I think that there are several facets to how I think we should approach this problem. Firstly, I think that as clinicians, we need to look out for signs and symptoms. We need to be aware of this problem. And if we do notice anything, we should be referring early to mental health services locally. We need to be educating our patients in the same way that one might consent someone for chemotherapy or for a radical prostatectomy. We'll tell them all the potential side effects, knowing full well that they're not necessarily going to get all those side effects. We're just giving them the information so that they're aware. Well, in the same way, we should be telling patients when we diagnose them with cancer, look, mental health problems, psychological issues and problems are not uncommon, and they're treatable, so that you're empowering your patient with that knowledge, and they feel more confident to come to you. There are many other ways we could address this issue. Educating staff, for example. I think the medical fraternity needs to highlight these problems, both to improve clinical research in this area, and also to improve the education of our staff, both trainees and nursing staff.
Fantastic. Well, Dr. Afshar, thank you very much.
Thank you very much.